Hello, this is Dr. Anita Brown, Director of Professional Affairs for the Georgia Psychological Association, and we're now beginning part 2 of our state advocacy training sessions. This one is going to focus on some pretty relevant and exciting current issues that we feel will be impacted going into the legislative session of 2021 and coming out of the current 2020 legislative session. Stan Jones of Nelson Mullins is our GPA's advocacy and lobbying consultant and friend, is going to help us to know the most up-to-date information going forward. So Stan, thank you.
Good morning again. Very nice to speak with you. I'm Stan Jones. I work at Nelson Mullins Law Firm on state issues for Georgia Psychological Association. I'm joined this morning by Helen Sloat, George Ray, and Sam Martique. The four of us work together as a team. We help each other out. You're always welcome to contact any of us if you have specific questions on pieces of legislation, on work before the state agencies. That means rules, reimbursement rates, changes in insurance products. These are the things that we specialize in for you, and we're happy to answer questions at any point. During this part 2 of the legislative training, we're going to talk a little bit about things that have happened during 2020 and then things that we are expected to happen in 2021. Let me repeat again that this is a very interesting era in the mental health world. There's never been higher interest in mental health services than there has been in the last 2 years, and is going to be in the next several years. It's driven by some increases in suicide rates, particularly among our young people, but adults as well. Some of that's driven by the economy. We're about to find out how much interest in mental health is driven by people struggling with loss of jobs during COVID or loss of loved ones. We expect there to be continued high interest. We're all concerned about our kids' drug use, and we're increasingly aware about brain science and how a wide range, we know a lot more now than we used to know, and can do things that with particular conditions that we couldn't have done even 5 years ago. So this is an exciting time to be involved. Let me talk quickly about some things that happened during 2020. They happened despite, the interruption of the general legislative session by the pandemic. I'm sure we got off to a 6 or 8 week start. Then we had a 2-month pause and finished up the session in June. A lot actually happened even despite the epidemic. So this slide calls your attention to some of the things that were interesting to GPA. The one that you see in front of you called Criminal Records Cleanup was a bill that affected several of the interstate compacts for psychology, for physical therapy, for physicians. And the governor's office, the attorney general, the compacts themselves, all include provisions that there be criminal background checks for any person participating in a compact to help a person in a different state. This is one of the clear central quality assurance methods for the states, allowing sort of cross-state practice in limited circumstances. Criminal records checks, in order to be sort of uniform nationally, have to be performed in a very particular way by the local law enforcement entity, the Georgia Bureau of Investigation in Georgia's case, and then their use of the FBI database about criminal records checks. So this first bill made an effort to make sure that the state law requires a criminal background check, so that can be required of somebody participating in a compact, and also that the check itself be done a particular way. The second issue listed is about balance billing. Balance billing is when an individual provider typically submits a bill to the insured or uninsured consumer asking for the payments that were not covered by someone's insurance, whether it's Medicaid, Medicare, private insurance, or state health benefit plan. This bill is best known as surprise billing. Surprise billing issues arose, in the circumstances when most often when a person goes to the hospital, has surgery, and then let's say the anesthesiology is not in network or the pathologist is not in network. So the insurance reduction of a bill doesn't necessarily apply, to these providers who are not in network for the particular insurance company. So people would go to a hospital that they knew was in network and discover that some of the physicians were not in network and were receiving surprise bills and sometimes very expensive ones. So Georgia passed its own balanced billing statute. It does set some limits around the charges for emergency services and charges for non-emergency services when they're provided by an out-of-network provider. It also has an arbitration process in it that allows a dispute between an insurer and a provider about a balanced bill or even about a bill overall to sort of have a technique in front of the Department of Insurance to resolve the differences in view about how much is appropriately paid. Most of the time, these bills may not affect psychologists a lot directly, but they'll certainly affect you as individual consumers. They may affect some procedures that you might participate in. It was quite an interesting shift, in Georgia. Georgia's sort of leading the nation in passing a bill that's actually different than the ones being considered in the Congress for ERISA plans and others. The third item, we've labeled it here COVID-19 liability legislation. And this was actually a bill that offers some protection to providers in treating COVID patients, from lawsuits that could result. Now, the liability protection essentially applies as long as there's not sort of a grossly negligent provision of a service, but it does offer some provider protection. It also offers, protection to places like restaurants. If they post the appropriate sign, essentially says you enter a restaurant on your own risk. We follow the guidelines put out by CDC more or less, and we can't be liable for your coming in here and contracting COVID while you're participating in a particular event. This one happened to start out as a sports event piece of legislation. I think it was driven by people wanting to be sure that college football was played this fall, but it got broadened to apply to widely to places of business, and it's pretty interesting. And it's Georgia passed a bill when the Congress could not on this issue. It will be probably surface again in the future Congress. But it is something to pay attention to, and we'll help you with questions you might have. We've listed here also a wide range of pharmacy benefit manager reforms. Georgia has 2 members of the House in particular who've had, bad family experiences with steering, prior approval issues, some around drugs, and these 4 pieces of legislation we're attempting to regulate some of the practices that are used by pharmacy benefit managers. So these are things used by companies like Express Scripts. You encounter them when you go to your pharmacy to fill a prescription. They're separate really from the health insurance per se. It may cover your procedure at a doctor's office or a hospital. And these provisions are much more complicated than most people realize. And so this legislation, it makes attempts to sort of curtail some practices that limit what pharmaceuticals you may be able to use. The budget ended up being very interesting. Georgia's economy has grown dramatically for the last 7 years. Each year it's produced about $1 billion of new revenue to be appropriated. The large chunks of that revenue go to the school systems and Medicaid. We had a sort of dip in revenues last fall. The governor initially proposed some 4% and 6% reductions in the budget. Those proved not to be necessary. The House and Senate restored some of those items that the governor had cut, and then COVID hits, and there's an intense fear that state revenues will fall off by dramatic amounts. So the governor initially said, I'm going to ask everybody to cut their budgets by 14%. Those were pretty big changes. As the legislature came to the close, that amount was reduced to about 10%. And most agencies dealt with that with some furloughs and layoffs. There were reductions in the school system budget, but there were also reserves in the local school systems that allowed some of those to be offset. There was a really interesting phenomenon in healthcare, and that was that the COVID patients, of course, were consuming huge resources in intensive care units and for protective gear. But at the same time, during this is in March, April, and May, June to some degree, people were not going to the primary care doctors as much, and they were not doing elective surgeries. So actually, Medicaid expenditures, state health benefit plan expenditures fell because there was less elective surgery and there were fewer primary care visits. And the total expenditures actually fell more than the increased expenditures for some of the COVID activities. So at least in the short term in 2020, finishing up the fiscal year and heading into the new fiscal year in July, some of the cuts on Medicaid state health benefit plans were not as extensive as were feared when the COVID crisis first struck. We're going to begin to see some shifts from that this fall and the first part of next year as people picked up again on elective surgeries, picked up again on primary care. People lost their jobs and became eligible for Medicaid for the first time. And so going forward, we're going to have some increase in state revenues. The fall off from COVID was not as great as expected, but we're also going to have some big demands, particularly in the health arena. So we keep an eye on that for you. And we can always answer questions about specific programmatic activities that you're interested in. Some mental health activities fell off, such as family supports for patients with developmental disabilities. Some things went up a little bit. There was more money put into the APEX program for professionals working in the school systems, but working through DBHCD rather than through the school system or through Medicaid. Some of this will be repaired as we go into the new session, some will not be. But holler if you got specific questions about billing codes, billing rates, prior approvals. All these things are going to continue to be relevant. And we're about to face also the first recommendations from a behavioral health commission that will deal with things like mental health parity and some billing code issues going forward, particularly around children. But that's a quick summary of what happened in 2020, and I'm going to turn it over to George and Helen for 2021.
So thank you, Stan. I'm Helen Sloat, a policy advisor here at Nelson Mullins, and I've had the honor to work with Stan Jones for 25 years. And we've recently been joined by Sam Martique, who's also a member of our team, and George Ray has worked with Stan and me for the last 5 years. And we're delighted to be before you this morning. So I want to touch on just a couple of things. There are some regulatory issues, of course, that we're going to be following for the remainder of 2020. Those really relate to the implementation of SIPAC and anything that might crop up about COVID-19. And when we think about COVID-19, we think about how perhaps that the state would be expending CARES Act dollars and those types of things. And under the implementation of SIPAC, I know you're very well aware that you have a colleague, Don Meck, who is a member of the National SIPAC Committee in writing the rules and regulations that will make that legislation of the compact, operational here in Georgia as well as in other states. So I know they're already soliciting input from the State Board of Psychology, asking questions, trying to understand just how to implement the mechanics on that. And that discussion actually came up at the most recent board meeting. So I want to touch on, though, a few of the 2021 potential issues that we're hearing about thus far. Of course, there's going to be introduction of a new version of what was referred to as House Bill 1241. It was a bill that was introduced late in this year's session, actually the last week of June, so it couldn't really make any headway. It was authored by Representative Katie Dempsey, and it would be a licensure proposal for behavioral health analysts. And I know that GPA has already been looking closely at this legislation and working through any concerns and what kind of statements they want to make in regards to that bill. Some other ideas that we'll see, telehealth changes, as it stands right now, the Department of Community Health lessened some of the rules and regulations around telehealth, making it more permissive and user-friendly for both the providers and the consumer. It now is in the posture of just determining how those changes will continue if the public health emergency continues. Stan talked a little bit about surprise billing previously. We understand there are going to be some additional tweaks to that legislation, more technicality issues as it relates to the law versus just the general overall theme of it. There will also be some discussion around care management organizations. As you know, the state of Georgia has 4 at the moment, and those contracts will be up for rebidding, I believe, next year at some point, or at least they will be issued next year for new proposals to be put forth by those care management organizations. There may be some changes in the law as it relates to that, about the bidding processes and the contracting opportunities. There are also ideas floating around what we refer to as EPSD, early prevention services, diagnosis and treatment for or children, the little children primarily. And we're trying to marry up the state law as it relates to the federal law and those requirements. And that's been something that we've nibbled on off and on for years. It continues to be nibbled on as we roll forward to 2021. We also anticipate a reintroduction of the Compact for Audiology and Speech Language Pathology. That legislation actually passed this session. It was yet another one of the compact bills. However, the governor vetoed this particular legislation under the guise, or at least one argument he made, that it needed to go through the Georgia Occupational Regulatory Review Council. We are in the process now of trying to understand more about that and whether or not we need to get a hearing before that council, because we hope that we can move that legislation forward for the audiologist and the speech language pathologist. Every year, it seems like we always have certificate of need up on the agenda, and certificate of need, as a reminder to you, regulates hospital-based services primarily, but it regulates all these various healthcare services in the state. And hospitals and physicians have typically been on opposing sides for the most part of this. There are some factions, though, that want to do away with certificate of need altogether and just have a free market system. So we'll keep our eyes on that and let you know updates as it rolls along. There are also proposals to change the law as it relates to the continuing education requirements for massage therapy practices here in the state. I know you've in the news about some of the illegal forms of massage therapy that go on, but there are some licensed professionals who are doing real massage therapy, and they are, of course, licensed under the state, and they have continuing education requirements, much like what a psychologist has. Stan talked a little bit about the budget. That's always an issue every year. We will keep you posted on any changes to Medicaid, state health benefit plan, or any other care management organization issues as it relates to the budget and what those impacts might be. And of course, there are always going to be regulatory issues. So we will hopefully be able to provide you timely reports and updates. We do, as Gail Spears mentioned in the first segment, we do publish a daily Gold Dome report during the legislative session, and we also provide other updates as needed to the association. So Stan, I think you want to talk a little bit more now about the elections that were just recently held, and I'm going to turn that over to you.
Well, folks, it's 1 o'clock on November 4th. It's hard to say, what the final outcome will be in the presidential race. It will be very close. I think whomever wins is going to probably have fewer than 280 electoral votes of the 270 needed. One thing you can say about the election in Georgia is, and it may be one of the most interesting examples about this, but a lot more people voted. As of 1 o'clock, on November 4th, we know that at least 135 million people voted. We're still counting votes. It'll probably edge up close to 138 to 140 million people before the counting is over later this week. In 2016, 107 million people voted. So huge interest in what's been regarded as kind of a watershed year in American politics. In the end, we probably will have not a lot of shifting. We'll probably continue our watershed until 2024. The Georgia had a huge increase in the number of voters. Georgia will hit about 5 million of its 7.6 million voters. I think many of us had thought that number might climb up to 5.5 or 6 million, which would have been an extremely high turnout in the 80% range. Right now, it looks like we'll hit around 70% turnout. That's fairly typical in an election year in Georgia, a presidential election year in Georgia. And it's much higher than the number of people that voted in 2018 and 2016 in the last presidential election. It'll be higher by 1 million votes or more, but it won't be higher as a proportion of registered voters. In the end, it looks like right now that it will not result in changes in the Georgia House or Senate controlled by the Republican Party. In the Georgia House, there might be 2 to 3 changes. In the Georgia Senate, right now, it looks like maybe 1 or maybe 2. That will leave the Republicans in control of both parties. I mean, both houses. You pick, which bills get out of committee, which bills have the best chance on the floor. Most bills, because the process is long and deliberate, requiring at least 7 actions, often, most bills by the time they get to the floor have got pretty close to 90% support. And certainly the things that we're interested in typically will fall into that category. But one thing you'll see is that because the election has been close, those people in both parties sort of get closer to the middle on their points of view. So you will maybe you've noticed that many of the Republicans ran both on the anti-discrimination legislation and also on sort of some other things like sex trafficking, which sort of humanized the Republican Party and brought it to more of a middle position on the things that people care about. We'll still have a lot of extreme politics, but you'll gradually see that the interest by those people who are able to win, their primaries will be a little bit more centrist. So that'll be one of the more interesting outcomes. It'll take a year or so to show up. Republicans will control reapportionment from the 2020 census. Georgia's population will get up around 11 million people. We'll reshift the boundaries for the legislative districts. At the moment, Georgia probably will not get an additional member of Congress, but the boundaries can change in each of the areas. The Georgia you may have seen that last night the Democrat seems to have won the Congressional District 7 in Gwinnett County. That's Carolyn Bordeaux. That's a flip nationally. And so we'll have, one more Democrat and one fewer Republican in the 14 members of the Georgia House. It's always interesting. We, of course, are political junkies. We have more interest than most people. We're probably a little bit of the nut and bolt metaphor that we were using in part one of this presentation. But we're always, again, willing and interested to answer your questions. And it's been our great pleasure to serve GPA over quite a long period of time. Thank you.
I know we're at the end of our time, and Gail, barring any questions from you, and I'll defer to you, but us as psychologists, the temperament, the tenor of the times. If there was one pearl, one kernel of wisdom that any of the four of you would offer to our membership, both as citizens, but also as professionals in a field that studies and reacts to and loves human behavior, what would that be?
I'll say for me, one pearl, I guess maybe it's two pearls. So one I've already mentioned a couple of times. There is an intense interest in mental health that has not always been there. But over the last 2 years and the next 5 or 10, there will be increasing interest in how you help people who suffer from a mental illness diagnosis or a behavioral one. And I will say the second pearl is the state government, as well as the federal government, are deeply involved in these issues. They help supply funding for a pretty large portion of the Georgia population. That happens through Medicaid and the State Health Benefit Plan. Of course, it happens through Medicare at the federal level. We're about to enter into some new waivers around issues for people who are low income but not eligible for Medicaid, or people who are in the working poor, who are going to gain some new insurance products they did not have. These issues get resolved at the state level. So we want you to be interested and involved. Don't just turn into a cynic that all politics is horrible, however many of us feel about what's going on from a ideological or philosophical or a cultural affinity point of view. There are things that are still vital to you and your profession, to you as individuals, that occur. And many of those occur at the state level, and we want to help you with those.
I'm interested in one thing, Stan. I know that when COVID hit, everybody was thoroughly convinced that, financially the state would just, be near collapse, that they were just going to have to gut the budget, blah, blah, blah. What ended up being the reality of that? How is the budget and how is the financial health of the state of Georgia right now?
Well, we did peak back up on unemployment to, hitting up with a large number of sort of service jobs ended up being lost from COVID. but we also had a few things like some new businesses that evolved as a consequence of it. So in the fiscal year that just ended, we ended up with relatively small budget cuts that, they affect the economy, of course. We had increase in unemployment insurance costs to the state and the federal government, but the tax revenues did not fall off as much as we expected. And then the recoveries in the first quarter of the new fiscal year, we're talking August, September, October, July, August, and September, they actually came back up faster than people expected. And so right now we're sitting where budget revenues for the current year are going to increase about 6%. Maybe will even out at 4% by the time we get to the next June 30th, and it'll be in the 4 to 6 range of an improvement when we start the session in January. And our unemployment has started coming down. But we will have a lot of dislocation because the service jobs in restaurants, the ballparks, entertainment, and retail have fallen off a little bit. But at least at the moment, the economic impact of the virus has been a little bit less than people feared.
Thank you.
On that note, once again, GPA, on behalf of GPA, we express our sincerest gratitude and appreciation for what you do for us, and look forward to the partnership moving forward. And,
It's our great pleasure. Thank you very much.
all right. Thank you. Thanks all.
Thank you.
Stay well.
Bye-bye.